today's interview is with Dr. Mayank Jain, who has scored 51st rank in FET 2022, and he has taken a seat in FNB Reproductive Medicine at KJK Hospital Trivandrum. Many congratulations on this, Dr. Mayank.
Thank you so much, ma'am.
So this interview is basically for you to tell us your story, your background, and then what was your strategy to prepare for your exam, what helped you get this rank and the seat that you have. So over to you, Dr. Mayank. First, tell me where you've done your UG and PG from.
Ma'am, I've done my MBBS from UCMS Delhi. I'm a 2012 pass out. Joining batch. And then, yes, and PG I've done from AIMS Jodhpur, MD. Okay. After that, for a year, I did my SIship from JIPMER Pondicherry.
When did you finish your PG?
2021, ma'am, August.
Okay, so a year ago, before
yes,
1 year before your exam, you started preparing.
Right, ma'am. Yes, ma'am.
After your PG, what were you doing?
I did 1 year senior residency from JIPMER Pondicherry, ma'am.
All right. So when did you decide to prepare for this FET or NEET SS exams?
Actually, ma'am, after the end of my senior residency only, I decided that now I have to move forward towards some specialty in obs and gynae.
End of your senior residency, as in you've done only 1 year of senior residency?
1 year, yes, ma'am. Only 1 year. I completed 1 year in September.
Okay, so, and then you decided to discontinue the senior residency.
Yes, ma'am. Actually, because being a COVID, my third year was at the time the COVID had started, so I thought it's better doing a senior residency for a year to get some hands-on, which I couldn't get in my MD final year.
Okay. So I didn't get, why did you decide to drop your SRship after September?
I was interested to go for specialty, and I thought 1 year was good enough, and it's very hectic in JIPMER Pondicherry. So I thought, okay, the skills that I expected that an OGistan should know, I had learned. So therefore I thought, okay, now after 1 year, I should go to some specialty and go for it. Yes, ma'am.
So when did you decide to prepare?
Actually, in November, INISSET I had given, ma'am. And that was the time when I realized that I was quite far behind when I had given the exam. The type of questions that were there, that was not just the basic MD level. That needed an extra edge that a person should have read or should have had some backing that might help them to pass. So at that time, I decided, okay, I'll start reading for it. And in mid-November, one of my juniors actually referred me to Reproneet Learning.
Okay, so that's when you joined.
I joined Reproneet, yes, ma'am. She herself is doing MCH in Kochi, ma'am, Amrita Institute.
Right. Yes, of course. So were you considering other fellowships in laparoscopy or reproductive medicine? The ones which you get without FET?
That was the plan to start with, ma'am. Because honestly speaking, the time between FET and the time I had started to prepare was very less. So the plan was, if I don't get into an FNB, I'll probably go into a private fellowship of 1 year or so in either laparoscopy or this reproductive medicine. But not being interested in this DM MCH course, because the course being 3 years, I thought FNB was the better among the two.
So you had to choose between private hospitals or institutes which offer fellowships, and then NEET SS and then FET. So you thought FET best suited your
exactly, ma'am.
2 years is the time that you wanted to devote to super specialization.
Exactly. And nowadays, in many ways, the minimal invasive is part of the curriculum in a lot of institutes regarding the laparoscopy and hysteroscopy.
So you get to learn both of these things.
Exactly, ma'am.
All right, wonderful. So let's go back to your preparation. November, you joined the coaching. How was your reading? No, before that, tell me about your MD days. What all did you read in your MD? What kind of a student were you?
Ma'am, in our college, it was the standard books only, ma'am. You have to read Williams Obs, Williams Gynecology. I was more interested in NEET SS, this Gynec Oncology as a part of my MD in the first 2.5 years, I'll say. So I was reading Barak and Hecker. I had made notes from Hecker, T-Lens and Speedoff, the basic books. That was what it was expected from us during our MD time also. And
you had read a lot in your MD years. You had read a lot. More than an average postgraduate student does.
I will not say that. I'm an average student only, ma'am, but this is what all was supposed to from us.
The reading, you've read almost all of the books.
Yes, ma'am. Speedoff, not so much, because I was not very much interested in reproductive medicine.
That time you were not.
Yes, ma'am. So the very important topics only I could read, the PCO, primary amenorrhea, contraception, most of these topics, not the whole Speedoff. for sure. But Obs and Gynae, yes, the whole Williams I had read with the notes. I still have my notes with me, which I during preparation also I checked through them, went through them.
Yes, and
for the preparation.
Those years, MD years of reading books did help in the exam.
It did, yes, ma'am, for sure. Like oncology, I didn't prepare. I just went through my notes once. Actually, after INISS, because I didn't look through the pattern. That was one of my flaws in my preparation. After INISS only, I realized, no, this is not good enough. What I have read in MD, so I have to go an extra thing. So I joined Reproneet and I started reading the reproductive medicine part. I went through your gynecology part, basic gynecology part that I read. Obstetrics and oncology I didn't refer to. And I think for a FET, this FET part, oncology is not that difficult.
Yes, that's what I'm saying. You read Berek and Hacker, you made your own notes, but still for someone preparing for FET, that's something which is not required.
Exactly. Hacker is not required if your aim is FET, I'll say.
Yes.
But Obs and Gynae questions were, the questions were not difficult, but the answers were like a googly questions only. Out of 4, you will be easily managed to rule out 2, but the other 2, they'll take you in a fix. You won't be sure what to mark.
So you have to have thorough knowledge.
You have to have, yes, ma'am. Because after Reproneet, actually my course, preparation was November and December till around 22nd. After that, I had to, I joined
in November and you prepared only for 1 month after that.
Yes, around 1.5 months I prepared. At that time, my preparation was quite rigorous. I was clocking some 10-12 hours per day for the exam.
1 month of 12 hours per day preparation. Wonderful.
Yes, ma'am.
Then what happens in December?
Actually, I was not very sure that I'll get the seat. So I got an opportunity to join as a senior resident in AIIMS Bathinda. So I took up that senior residency, and because of a new place, even if you try to, adapt to the situation, the surroundings, and also I couldn't read much in my last month of preparation, which should have been quite an extensive revision, I'll say. So in month of January, I didn't read much, about I think 1.5 to 2 hours per day. That is the most I could give.
All right.
So your notes were very helpful for revision, ma'am. In November and December, I went through your lectures. I think 70% of the reproductive, 70-80% I had completed. But the remaining part, somehow I couldn't complete.
And you didn't have time for revisions also?
Revision from notes I'll do, ma'am. In those 2 hours, what I used to do was give you the test, the questions are there at the end of for every lecture, like every part. That I'll give, and then I'll go through your notes once. Okay, this was there, okay, this I missed, like that I'll do. So your notes were more important. I didn't have time to go through your lectures again and again. So your notes were very helpful to me. Like I'll go through the notes. Okay, I'll remember, okay, this was that I missed. So for reproductive medicine, I found your notes really, really nice. And basic gynecology also, I think as an MD, we don't read the topic that extensively like you teach. So that was quite helpful to me, at least, ma'am.
All right. Okay, so how did you find the paper? How was it?
I'll not say it was easy, ma'am. It was difficult. Like reproductive medicine questions, I don't know how many I correctly answered, but like it was not that it was like not a very brainy question that you will have to think about it. But Obs and Gynae, yes, I had to wait. I had to think. It was that kind of a paper. So I think my mistake was I didn't see the previous years when I started my preparation. I went through previous years only in month of January. So then I realized that the INISSET and FET, both exams are very different in their curriculum as what they give in questions. So that is an important part. I think every person who's preparing for the exams to be focused about what exam you're giving and have your preparation according to that.
All right. So one more question. Now, what the impression we are getting is that you read a lot in your MD years, and then again for the exam you read from November 12 hours a day. What did you do in between? There was 1 year. So was there time to read?
During SRship, no, ma'am. JIPMER SRship is very hectic, ma'am. So I didn't get at any time to read whatsoever. No theory revisions also, or like that. Only some few new things you will come up. That is like basically what you do, but not a topic. You won't go through it thoroughly. At least I couldn't do it during my SRship.
So what do you believe helped you secure this rank when you read in MD and then I believe that you could have done a little more. You could have given it a little more time.
Yes, if I had planned it previously properly, if I think 4-5 months is good enough time for FET. I didn't give NEET SS, so I don't have the point of view for that. But FET, if you are thorough in your revisions, if you are following the lectures, this question mock tests which are there, I think 5-6 months is good enough time if you can give it properly. If I had that time, probably my rank would have been a little bit better, but
But still, you
no
have a good
complaints
rank
there.
and you have a good institute. We'll also talk about the institute that you're working in. Before that, what I wanted to know was, how was the exam? You found it difficult, you said. How many did you attempt?
I attempted 92, ma'am.
Okay.
I went with the aim that I will do 90 at least. Like I always go with this aim in any exam. Most of the exams I go for, because less than 80 is like you're out of the way. That is what my thinking is. That is not true for everyone.
That is
but
true.
That is what is my thinking.
Yes, that is more or less true only, because all the people I have interviewed have answered from 90 to 95 questions.
Yes, ma'am.
Now, let's talk about your institute, KJK Trivandrum. How are you finding it since you've joined? How much time
it has been. I joined on 15th, ma'am. So about a week. I mean, more than a week, 10 days.
More than a week now. So how are you finding it?
Quite beyond the expectations, actually, ma'am, because we are seeing my rank. This was the institute that I got, but it is quite nice here. The academics are really good. They do give a lot of hands-on. Today only I did one more hysteroscopy.
Hysteroscopy. How many hysteroscopies did you do in your first 10 days?
I had done 3 today, including today 4.
Okay, so you're a fresher. You have just joined and you have done 4 hysteroscopies in your center.
Yes, ma'am. Yes, ma'am.
And the academics you're saying are also good.
Very nice, ma'am. Twice a week we do have classes. The sir who's involved, I mean, for our curriculum, he's very, enthusiastic about the course. So he's quite enthusiastic about teaching and academics. So it's quite nice there.
So it's a very, very good center then.
In my opinion, yes, ma'am, because
yes, of course, it's much better
hands-on, they are giving a lot of things are happening. Like they say, they claim it's around 40-50 pickups and embryo transfers in a month. Like it's a good center.
Then you'll be getting hands-on of embryo transfers and oocyte pickups also.
Most likely, yes, ma'am, because I've seen my senior, who's 1 year senior to me, she has done ovum pickup in front of me only, she did. So they do get hands-on, yes,
It is very nice. It is very nice to hear that you read for the exam. You could give only 1 or 2 months, but still the rank that you managed to get has got you this wonderful seat. So
exactly,
it's really nice. It is. I feel proud of myself. You know, that 1 month of you knowing me just for 1 month, reading just for 1 month from my classes, you've got a college, which is, I believe, very good.
Ma'am, that I'll say it's a blessing because I didn't know about Reproneet before my preparation. So that extra edge, I can tell the people who are seeing this video at least, that will give you that extra edge that is required.
So let us discuss the tips that you would want to give to your juniors who are preparing for the next year.
I can say what mistakes I did that can be improved, ma'am. First of all, you should, plan prior to this. Like I had very few months. I think 5-6 months is good enough time. So have something like what you are planning to do. NEET SS, INISSET, FET. I think that is a better thing to be focused about it. Secondly, MD knowledge is good enough for obs and gynae, but I think reproductive medicine knowledge, if you're thinking you're going without preparation or without the additional information, like because I don't think Gartner's anyone can read, ma'am, after MD. Even during MD, anyone can. I don't think, I have never read Gartner's.
You will not understand also because you're not practicing.
Exactly, ma'am.
You can't memorize the whole textbook without understanding.
Additional thing has to be taken. Third mistake that I did was I changed my places of work, which I'll say had their own benefits, but for the exam, I did not have the time to revise. So don't try to jump from places just near about your exams. Don't try to change courses on someone else's opinion that this course is better, that course is better. Take one course. I'll say Reproneet, I took the crash course and stick to it. Because at least Reproneet, I can say yes, ma'am, because you have covered all of it. Oncology part I didn't see, but the gynecology, obstetrics, and reproductive medicine part for sure it will cover. Like I wrote the recalls from the INISSET also exam, and so when I was going through your videos, I realized that almost all questions are from your notes. Almost all, I'll say.
Yes, that's true for oncology also. For FET, people don't have to refer to oncology notes that I provide. But if you ask INISSET onco people, they're also saying that the whole paper, we could.
Must have been, ma'am. I don't have any doubt regarding it. Must be true.
INISSET papers are more predictable. They're easier to predict. Though they're difficult, the
Uh,
competition is more, but still. So it was wonderful having you over, Dr. Mayank, for this interview. We'll definitely stay in touch, and I'm very happy that you are happy for the institute that you got. That's the
yes, ma'am.
that's the end result which matters. Your rank now is not going
Exactly,
to
ma'am.
matter. 51 is a decent rank, but what you've got is a very good place, not a decent place. It is one of the best places, I believe. All the interviews that-
Exactly, ma'am. Bilkul say. I mean, and thank you so much, ma'am. Thank you for your the notes, the way of teaching. Actually, it helps in remembering by revision. So thank you so much for that.
Oh, wonderful.
That is all. The regards only. That is all I can say.
Thanks. A lot of blessings to you for your future.
Thank you so much, ma'am.
All right. Okay, then I'll sign off.